Okay, so I'm going to introduce the panel. All the way at the end here we have Margaret Drew. She is an associate professor of law with the University of Massachusetts Dartmouth School of Law. Professor Drew is a director of clinics and experiential learning. She teaches human rights at home clinic, professional responsibility, and domestic violence. Her research focuses on intimate partner abuse and other forms of gender violence. She has also written on clinical pedagogy and the legal consequences of HIV. She was awarded the ABA Commission on Domestic and Sexual Violence's 2020 Vision for her work in implementing the Violence Against Women's Act and her representation of survivors of domestic abuse. In 2015, she partnered with Caitlin Stover, then of UMass Dartmouth Nursing, and Jason Potter of UMass Lowell to research the needs of those living with HIV in the South Coast. Please welcome her. Dr. Inga Corliss is a graduate of the Bellevue Schools of Nursing and received her BS degree in nursing from Boston University and a master's degree from the University of Rhode Island, and her PhD in sociology from Brown University. She had a Robert Wood Johnson postdoctoral fellowship at the University of California, San Francisco, and was present in San Francisco in the early days of the AIDS pandemic. She is currently professor at the MGH Institute of Health Professions. Thank you. And Dr. Lynn Desmond is an assistant professor at UMass Dartmouth. Throughout her career, Dr. Desmond has focused on patient safety and interventions to mitigate risk and improve quality outcomes for patients and staff. This motivated her to continue her education and obtain a Bachelor of Science from Corliss College in New Jersey and a Master of Science from Virginia Commonwealth University and a PhD from nursing at the UMass Medical School in Worcester. She held a variety of senior leadership healthcare positions, including Director of Nursing Quality, UMass Medical Center, Worcester, Mass., Assistant Vice President of Nursing at St. Elizabeth's Medical Center in Boston, and Administrative Director of Women's and Children's Services, Swedish Medical Center in Seattle, Washington. So we're going to start with Professor Drew. The first question is, there were many societal issues in the movie. What do you see as the 2 or 3 most important forces that changed how nurses cared for AIDS patients?
Well, I think that the first thing I noticed with these nurses was their compassion. And they recognized that not acknowledging someone as a human being interfered with what their goals were in nursing to begin with, right? To bring healing, to bring comfort. I was impressed that they were strong enough to develop this unit despite resistance. And I think that part of this was their commitment to holistic nursing, which is really how we all want to approach our patients or clients in any given situation, is to recognize that it's more than just the technicalities of our fields.
Thank you. What are the relevant issues that still need to be addressed in caring for this population today?
Well, it's interesting from the study that we did. I mean, back in the 80s, I was part of the AIDS Action volunteer lawyers, and our immediate the needs of the patients were, guardianship for their children, estate planning, because there wasn't any way to stabilize the condition at that point. So people knew they were going to die, and it was all end-of-life planning. So fortunately for the lawyers, that piece of it is over now. And there's still many more issues, legal issues and other issues. Disclosure, lack of confidentiality is huge. people losing their jobs still happens. Losing housing, not being able to obtain housing. So from our perspective on the legal end, there's still many, many complications that come for people who are living with HIV. But I'm happy to say that we have strong partnerships with medical communities who are able to refer their patients to our clinic for legal assistance. And I still see the same characteristics in the medical community giving care to the patients who are compassionate. They recognize that the social determinants of health make a huge impact on how someone is able to cope and survive with serious illness. And so I think a lot of it is the same in terms of what the healthcare should be, right? With the compassion. You know, just the touching is so important for people living with HIV. And when this unit started, there was no touching. I mean, we heard one man say that he hadn't been touched for a year. That's how it was, because people were so afraid. So this particular medical community overcame that, and I think there are still many, many nurses working today who have the same attitude, not just with HIV patients, but with those who are marginalized. And I think it makes a huge difference in how people deal with their illnesses.
In your view, what role do nurses and the healthcare system play in helping shape societal values today?
Well, I think that just as in the film where the nurses started change, created change, and changed in the medical world and in the general public how people living with AIDS or HIV were treated, I think the same is happening today. I think that it's the nurses who tend to look at patients' lives more holistically. So many of the nurses I know who are treating people with HIV are mindful of other needs in their lives and the social determinants of health, and reach out and find resources for the patients, and form partnerships with other community members who can help together we can improve the lives of those living with HIV.
Thank you. Dr. Corliss, as you were in San Francisco in the mid-'80s, what were your observations of the pandemic? I need the mic.
It was from a scientific perspective, it was a very interesting place to be. There were a limited number of people who were interested and concerned about this. And so I was there as a postdoctoral fellow. One gets to meet everyone because it's a very small room in terms of the people who are interested in caring about this. And yes, I knew Cliff Morrison, I knew Paul Bobeting. I brought this book because when I was there, I realized that the neurologists were talking to the neurologists, the lawyers were talking to the lawyers, the nurses. And I thought, well, what about the educated adult? How do we, get information for everyone? And so I ended up co-authoring and co-editing this book with Mary Pittman Lindemann, who at the time was working for the San Francisco Department of Health. And this book is called AIDS, Principles, Practices, and Politics. And I can tell you a little more about it, but Paul Bobeting is one of the authors in here. Back to what was it like. I did some research with some men who were HIV infected. I'd gone over to the ward, I'd let them know that I was interested in doing research. And I raised the question to myself as to everyone is looking at the virus, what about the person? When you look at it epidemiologically, there's a virus, which is the vector, but there's also the individual, the host. And so I did some work. I had done some work in terms of relaxation before. And so did some work with them on relaxation. And we would start each day that we met, they would draw a picture of themselves. And then I would ask them to tell me about the picture. And that's how we started the session. And we talked about what was going on. I did some therapeutic touch, that was the relaxation that I did. I've been educated and trained in that. And I had made them a tape, a relaxation tape that they could play twice a day or more often if they chose, to help them to relax in a situation that was really horrendous. The interesting thing about the research was, because I had done some other research, I thought, oh well, we need a control group, we need the intervention group. But after 5 weeks, the control group, who was not getting the intervention, also got the intervention. And when we looked at the data, what was so interesting is that, and on reflection, it makes a lot of sense, the people who did not get the intervention immediately were just, the anger went way up high. They never expressed it to me, but it was there in the data. And it made sense because if you have a life-threatening illness for which there is very little that could be done, aside from treating people appropriately and compassionately and trying to do something about some of the other illnesses they were confronted with, it makes perfect sense. Let me just add, I met a man who told me he had to choose between treating the infection in his eyes. He had cytomegalovirus. And if he treated that, they couldn't do anything for the HIV, and he had the choice of whether he was going to lose his sight or have some treatment for the HIV. Which is very, very difficult to hear, and something much more difficult to bear.
Thank you. You mentioned touch. What was it about the aspect of touch that was so important to how the nurses cared for these patients?
Well, people were not being touched. No one was coming and giving them a big hug except their friends, and certainly the nurses and on 5B and other nurses as well, but particularly 5B. But I brought something because I'm working on another paper that just got submitted today. And I found this in a paper that I cite in the study. And I want to give full credit to the author. The author of this is Okoro and Odina, and it's a paper on HIV treatment in African American women, care that makes a difference. And I cite this in my other paper, but I thought there were some things in here that you might be interested in. And it talks about physical touch. And just 2 quotes I want to share with you. When you come in contact with a person, especially somebody who's newly diagnosed with HIV, I've noticed if you touch them, even if you just pat them on their shoulder, it makes a big difference because they realize you're not afraid to touch them. When you walk into a room and you shake their hand, you just see their face light up because they see that you're not afraid to touch them. I feel like that's how I build a relationship. I'm not afraid to touch them. It does make a big difference when you have that communication of not being afraid to shake someone's hand. And that one goes on, but I want to go on to another one that I think you'll find interesting. So you're sitting across from a person that is telling you this with their hands kind of folded up. Anyway, they're pulling back, even when they are telling you they're pulling back. You know, telling you what, the quote doesn't say, telling you about your disease. So they are rejecting you as they are telling you that. To get up and come around that desk and reach out to them would be phenomenal. Because I will never forget when they told me. And it was like there was 3 people there. Not one of them touched me, except to shake my hand on the way out of the door. That's not what you do to someone who you've just told that they are HIV positive. And his voice breaks on a sob. So that stayed in my mind until that day that, and she mentioned the doctor's name, made me feel like I was somebody again. She would smile at me. She would shake your hand. She would give me a hug, you know? And none of the other care providers had ever done that. I had never had a health provider to hug me. And the day that she hugged me, I cried. Because it was like, right there, then I was connected to another human being. I was made to feel like somebody and shown concern like no one else had really done.
Thank you. Why was the decision to let patients determine who was family significant?
I think the film made that very, very plain. Some of the family did not want anything to do with their offspring. And then the people who were dearest, even for those who did want something to do, the people who were dearest to them in terms of their loved ones and their friends could be blocked out by the family. That was done. Or they would have access. Someone who's been their partner would have access until the person died. And then the family would swoop in, take the patient, the former patient, person who had died, their loved one, and take them back to their community, wherever that was, usually out of state. And the partner was not welcome to come there to the community. It's why they had so many services, you know, in San Francisco, because they weren't welcome at services, the other services. And so they did have services, and it was important that each person be honored and respected and love shown for that person and with the people there who survived.
Thank you. And finally, how do we as nurses and members of the same profession care for other nurses when some have opposing opinions on how we believe patients should be cared for?
You know, would you say more about that question? I wasn't sure what you meant by that question.
So how do we care for each other as a profession when our views may be clashing?
I found that there were people who did not want to go in and care. This is what I was, by that time in North Carolina, who did not want to go in and care for HIV patients, but there were others who did. And the reason they often came was they were trying to get pregnant and they were worried about getting any sort of infection. But there were nurses who were willing to care for people with HIV. And on this unit, you know, I would come in early before I brought my students in. And the nurses told me there was this gentleman with HIV in this particular unit. So once my students were all placed, you know all about that, in there and taking care of their patients, I went to the room and asked if I could come in. And he said I was the first person who came in. And I asked if I could sit down. I sat down next to his bed and we talked for a while. And then he had to go up for further examinations and had some tests being done. I found out later that he died during those tests. And I've always been so happy that I took the time to sit down next to his bedside, one person to another, and listen to him. Some nurses were not able to do that. They were in a different phase. I just really worked with the nurses who were able to do that. And we proceeded, actually, at the University of North Carolina at Chapel Hill. And I got in touch with a physician, dentist, a physician, someone in public health, someone in pharmacy. And we developed an HIV, the first HIV course at a university. And we had 1, 2, and 3 credits. You'll appreciate 3 credits for the people who really wanted to do more intense work, and they in addition to the course, they had a seminar. And the 2 credit people had to write something. But I thought there would probably be, now, this is going to sound terrible, but I thought there would be a lot of people who perhaps had devoted themselves to various sports who might miss 1 credit to be able to graduate. And I thought this would be really important that they had this course, that they learned something that would be helpful to them and to their future. And so they could come to the course, get their 1 credit by being there, didn't have to do any exams, didn't have to say they were there. And it was just another opportunity to sort of reach out and try to, dissolve isn't quite the right term, but try to reduce the amount of stigma, the amount of concern by having various opportunities to participate and to learn. And so even with our fellow and sister nurses, that was important to do when they were ready to do it.
Thank you. Dr. Desmond, what do you believe helps move individual nurses from fear to being courageous and providing care that gives hope?
I think we saw many examples of that in the film this afternoon. But when I thought about this, I thought many of these nurses that took this step to take care of these patients at a time when we knew so little, probably had the support of at least 1 significant person in their life. That person might have been a parent, a sibling, but as you can see with the amount of fear there, that sometimes it may not have been a parent or a sibling, somebody close to them that would support them in making this kind of decision to go and care for this particular group of patients. So often what I think may have happened, what I believe may have happened, and what I've seen happen in the years of nurses who feel led or passionate about something they should do, it's often a fellow colleague who listens to them and listens to their passion about what they want to do and where they want to go. And there's 1 person that says, I believe in you. I believe that you can do that. I believe that you can go and make a difference. And I think it's having 1 other person support us at some point that we make that challenging decision to move from fear to action that helps us do it and helps us be successful in making a difference.
How do we support our colleagues through these difficult types of situations, especially if they don't tell us they're in a difficult situation?
So I think in the film, when that nurse stuck herself with the needle, she didn't want people to know. She didn't want to share that information originally. But based on what happened in the film and those people closest to her, I think they probably knew pretty quickly that something was wrong. And I think in our busyness of lives and what we're doing at work or what we're doing at school, sometimes our intuition tells us that something with someone we care about isn't right. And we need to take the time to listen and support them in those moments. So we need to find the time, and that was so evident in the film as well for all the people that did take time I especially like the actress that went in every other weekend, celebrated with meals with the patients. And so, but I think the message there is we have to really spend time with each other and support each other.
What things helped you that you can share that may possibly help nurses care for patients when they encounter the same diagnosis with someone in their personal or family life?
So, having worked through the 80s, we really had to deal with it from taking care of patients. But what I didn't expect to have happen was my husband's mom was diagnosed with breast cancer in the early 80s. And so she went in and had surgery. And she was in the San Francisco area. And she had blood transfusions. And so shortly later, she was diagnosed with HIV and AIDS. Because at that time, there wasn't any testing on the blood. So blood was being given to patients. And so although she survived breast cancer, we lost her to AIDS in 1986. And so I think the hard times come when some of the things that we're dealing with in healthcare, we feel most helpless about caring for our own people. My husband's, at the time, was a hospital administrator, and I'm a nurse, and so many times when things happen and they hit in your life differently, you feel helpless. And yet the caring is on a different level and in a different way. And so I share that because in your journeys, in your professional journeys, when you leave here and leave school, you may encounter a different diagnosis with people that you know and people that you love. And so it's going to be important that you're able to think about how you care for yourself and them during those times. And so whether it's this or some other diagnosis, it's really something that you have to think about because you will encounter that at some point in your journey.
So we now welcome questions for our panel from the audience.
I would just like to add that sometime during your careers, you're going to encounter something similar, you know, with what is happening with resistance to drugs and, you know, other factors. It's likely during your careers you'll be faced with a choice of whether or not you're too afraid to treat someone or whether or not you can overcome your own fears and do what these courageous nurses did in San Francisco.
The movie was phenomenal. I was a nursing student who grad during the time that happened, and it was a challenging time. But my question is, who had the insight into filming what happened on 5B and some of those older interviews, and how did that process happen that allowed us to experience this at the time?
I don't know.
I got the sense that they were doing it for publicity and education, because Hank said at one point, the reporter said that he didn't realize he was being used.
Yes.
But he was fine with it, that the nurses were subversive because they wanted to be filmed when they were touching the patient with AIDS. So I don't know who came up with the original idea. I'm wondering if it was the reporter, but whatever it was successful.
Absolutely. It's a gift to see what they did in the past.
Thank you.
I can check with Cliff Morrison.
Oh, that would be great.
Yeah. I'll get in touch with him
That would be great.
and find out. Right.
Any other questions?
It was so quiet.
I have a question. As nurses, I think we are all at some point faced with internal stigma and just faced with our own internal biases when working with someone who's different from us that we perhaps don't always understand. So I'm wondering if you have any advice as to how to overcome those internal biases.
That's a great question. I think it's something that we all need to consider as we care for patients. We have to put our own thoughts and feelings aside and focus on what's important for the patient. I think that's something we all learn from experience over time. I don't think it's something that's always easily or readily learned because in our culture and in our society, the news is always focusing on who's different and why they're different. So for these nurses to do what they did, for them to be able to put all of that aside with a time of such fear, it was so courageous for them to do it and to do it so beautifully. And the film really does capture that.
On the law school side, we have to deal with the same thing, right? Because sometimes there's a client who's done something that, you know, the student may find repulsive. But I think the same in the medical profession, you need to go back to your professionalism, the oaths that you take, and your commitment to doing the work. And I think that if you can just get to know someone and hear their story, you're going to have much more compassion for them. And so when we look at what someone has done as opposed to who they are, that are in the medical field, what conditions they might have, as opposed to who they are as people. Once you can do that, I think that it's really helpful in suspending your judgment and doing your work professionally.
I think the patients and the people you'll remember are the people you took the time to sit down and get to know them. And you can learn all sorts of things from your patients. Brief example, when I was a student at Bellevue, second year, we were in the OPD, and I had everything, I completed all the work that you were supposed to do. I don't even remember what it was we were supposed to do, but we did it. And there was only one person and a patient, sitting on a wooden bench. They have these huge wooden benches. So I got out from behind the desk. I remember this lady talked about getting out from behind the desk, not having a barrier between you and your patient. And I sat down next to her. And she started to tell me about her life. What a gift. I mean, what a gift for patients to share their lives with you, to share their concerns with you. It means they trust you. I'm just sorry, I don't remember this woman's name, or I would try to get back in touch with her to say thank you. I learned so much from you. So I don't know that answers the question, but you're going to see all sorts of things, and take reasonable precautions. There are reasonable precautions. If I were taking care of somebody with Ebola, there are precautions I would take. But I would also remember this is a human being who's just so frightened. And that's the case when you're in a hospital. It's a strange place, and nurses and other healthcare providers, other tourist guides to this place where they speak a strange language. Even if you speak English, the language is different that healthcare providers use. And a lot of patients don't know that language. And they're all, the way things are done are different. You may not get breakfast, you may get breakfast at 6 in the morning when you usually have breakfast at 8, and you may be roused. All sorts of things happen in hospitals. So you're the tourist guide for your patients, helping them to understand where they are and trying to help them become calmer and feeling safe, because they're in a different country, and you're the tourist guide. So even for people you may have heard things about you are still the tourist guide. And you know that even for those people who do horrendous things, if they're wounded, we still give them care. We still give them excellent care.
Thank you so much. No other questions? Okay.